6 months now into the pandemic, we are still learning more every day about the coronavirus and its symptoms. Channel 3's Nicole Nalepa is getting some advice on determining a COVID symptom from the flu or even something else.
One of the many frustrating parts of this virus is the fact that there are so many potential symptoms, like headaches. So if your head hurts, how do you know if it is or isn't COVID? Dr. Valerie Katz is going to help guide us on this topic. She's a neurologist at Hartford Healthcare's Headache Center in Fairfield County. Thanks for joining us, doctor.
Thanks for having me.
Unfortunately, for those who suffer headaches or any other symptoms that are listed on the CDC website for coronavirus, the first thought that pops into our head is most likely, do I have it? So is this a common symptom? What is the data showing?
Yes, this is a common symptom. So we now know that coronavirus affects the nervous system both inside and outside of the brain, and headache has been one of the top symptoms that we see here. It's listed on the CDC website as one of the first symptoms you could experience in acute illness, as well as seen in patients worldwide. So we know that even people without pre-existing headache conditions can experience headache at the onset of a COVID infection, and we see young women being affected more.
Interesting. So how are those who have COVID and experienced a headache describing it as? Because I know there are a lot of subtypes of headaches. Like we know about migraines, people explain tension headaches and clusters they feel. But obviously, as you know in your practice, there are so many different types of pains that people can experience.
So there's still a lot of research about how to best characterize a headache due to COVID infection. What we see anecdotally is people describe symptoms of either migraine type headache, tension type headache, or really a combination of both. And how we're treating it is we're treating it as a secondary headache condition, so a headache due to viral illness. And then we treat it based on the symptomatologies that patients describe.
And can those who are recovering from this virus also experience headaches?
Yeah, we are seeing a small subset of people that have prolonged headache symptoms long after their acute illness is over. And this can either be episodic or an all-day, everyday headache. And the way we describe this headache is a new daily persistent headache. It is very bothersome to patients and causes them to present to medical care.
All right, Dr. Valerie Katz, thank you so much for all of this information on the topic.
Thank you. Thank you so much.